Minister, in the past, you've agreed that the toxic drug crisis is a health issue. Is that still the case?
Absolutely.
So, Minister, you know that it's illegal for people to have personal use of or even have illicit substances on them in Canada, everywhere east of the Rockies. You're aware that that is the case right now?
Yes, I'm aware.
Okay, so that being said, it's a criminal issue in this country. Would you not agree?
I would say that at this point in time, decriminalization is only available as in British Columbia to refer people to health services.
Okay, so you agree that it's a health issue. Your government, the Privy Council, went out and did polling to see whether the Canadian public supported decriminalization. Polling was mixed. If the polling was really high in support of decriminalization, would your government gone ahead and moved decriminalization sweepingly across Canada?
First of all, thank you for the question, and I want to thank the member for his advocacy. As I've said, both in this committee and in the House, as we move to address this health crisis, we also have to make sure that we have all tools in place, both from a public health and public safety lens, which means that we have to ensure that full wraparound health services are in place as we move forward with other tools such as decriminalization.
Minister, I can't think of another health issue where the government's going out and doing polling, whether it be heart disease, liver disease, what decisions they're going to make, how they're going to maneuver around health. Can you think of one?
The Privy Council office does polling on a myriad of issues.
Has the Privy Council done polling of the 42,000 families that lost loved ones, and whether they should ramp up and scale up a safer supply of substances to replace the toxic drug supply?
I can't speak to if such specific polling was done, but what I will say is that I meet with families across the country constantly, unlike the opposition who refuses to meet with families, including Mom Stop the Harm.
You believe that this is an addiction crisis or a poisoned toxic drug crisis?
This is an issue of a poison toxic drug crisis that is leading to an addiction crisis.
Right. So right now, your government is making policy decisions, health policy, on polling. This is absolutely cruel and harmful. The stigma is so real just by doing the poll on decriminalization. Do you not agree? Do you not see this?
I thank the member for his question, Mr. Chair, but I find the question, first of all, rather odd. We base our policy on evidence and science and interactions with health experts from across the country so that we have a full and robust understanding. I don't think any responsible government addressing healthcare would guide their policy strictly on polling, so I take issue with that, Mr. Chair.
Well, I can't think of any government doing polling on healthcare policy and healthcare decisions. So that's my response to that. Now, we know that there is nowhere in this country, no territory or province, even the Alberta model that's got one therapeutic centre built out of the proposed 12 or 13, there is nowhere that we have treatment on demand. I don't think we need to go and poll the public to see that we need to scale it up. Why has your government not found a way through the jurisdictional quagmire like you did through COVID to ensure that we have a treatment and recovery program on demand to meet people where they're at now?
Through you, Mr. Chair, I thank the member for his question, and as I've stated earlier, this is exactly why, in addition to the $200 billion of agreements, of which 25 billion of that towards of the 25 billion, mental health is a key principle. This is why we're making these investments in health jurisdictions. This is why we've put a $595 million towards over 400 projects through SUOP. This is why this government has put $1 billion on the table to address substance use and the overdose crisis in this country since 2016.
Mr. Johns.
So you've got the Canada Drugs and Substances Strategy, and it's just that, a strategy. There is no timeline, no dollars tied to that timeline. Portugal took an approach where they had a timeline, they had resources tied to the timeline. Minister, you have still not laid out a plan. We had an auto summit. I asked you repeatedly when we're going to have a First Minister summit on this crisis, not saying that auto theft isn't an issue, but this is a real issue. You said you were going to reinstate the expert task force. We have not been explained or told how that's going to roll out. When is the expert task force going to roll out? When are we going to have a first ministers meeting? And when are you going to actually table a plan with a timeline? People are dying rapidly. You don't need to do more polling to figure that out.
Through you, Mr. Chair, thank you for the question. I believe we are on a plan. The CDSS is exactly that. However, every agreement that has been signed with every jurisdiction is attached to a work plan of their plans of what they know best for their communities and the investments that they need to make in addressing the mental health and substance use crisis. That being said, we continue to work with them. We continue to add additional investments, whether it's through SUOP in the most recent round of $144 million, whether it's through the Emergency Treatment Fund, which will be rolling out in the fall. We have to work with jurisdictions and we have to work with communities. They know best.
Minister, it's still spending less than 1% than what your government spent in response to COVID. Why? Because of the stigma. That is so clear and evident right now.
Brief response, please. We're out of time. Minister?
We are addressing this as a public health crisis with the utmost priority.